Did you know that over 60% of the cats in the United States are either overweight or obese? If you're new here, welcome. I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the videos so I can create more content like it. And that extra weight could be silently damaging their kidneys. If you're caring for a senior cat, particularly one that's recently been diagnosed with chronic kidney disease, it's important to understand all of the factors that can impact their kidney health. Obesity is one of the most significant and often underestimated issues affecting cat health. In this video, we're going to explore whether there's a link between obesity and kidney disease in cats. I'll explain the latest research on how obesity affects kidney health, both directly and indirectly, and other practical advice for managing your cat's weight to support their kidneys. So let's get started. Let's start by addressing an important fact. Obesity is a serious and often underestimated health concern in our cats. In the United States, at least 60% of cats are overweight or obese, and this has major implications for their overall well-being, including their kidney health. Many people assume obesity is just a cosmetic issue or something to worry about later, but it's far more harmful than that. Excess weight can quietly damage organs and contribute to chronic diseases, including conditions that affect the kidneys. Now, when it comes to chronic kidney disease, or CKD, obesity is not considered a direct cause. Most CKD cases in cats result from age degeneration, genetics, past kidney injuries, or other illnesses. However, obesity plays a significant role by increasing the risk and severity of kidney problems. Overweight and obese cats are much more likely to develop diseases like diabetes mellitus, high blood pressure, and urinary tract issues. Each of these conditions can place additional strain on the kidneys and accelerate damage over time. Beyond this, the fat itself is metabolically active, meaning it just doesn't sit there. In obese cats, fat cells release inflammatory chemicals called cytokines. Those cytokines cause low-grade chronic inflammation throughout the body. This inflammation may contribute to tissue damage, including within the kidneys themselves. Obesity also decreases the cat's mobility. Heavier cats tend to move less, which means they tend to drink less. They just don't have the energy to get up and go to the water bowl or water fountain. And we know that chronic mild dehydration stresses the body. That stress can affect the kidneys, and that chronic stress to the kidneys can affect overall kidney health. Finally, research done in humans and dogs shows that obesity can cause the kidneys to work harder. This process of working harder than normal is called glomerular hyperfiltration. While studies in cats are limited, as always, veterinarians believe a very similar effect occurs in our obese cats, which then adds further strain to their kidneys. So while obesity doesn't directly cause CKD, it significantly increases the risk and can worsen kidney disease outcomes. That's why keeping your cat at a healthy weight is critical for their overall quality of life and their kidney health. Now that we understand that the relationship between obesity and chronic kidney disease isn't really straightforward, but still significant, let's take a closer look at how excess weight can affect your cat's health. One of the main ways that obesity impacts kidney health is through the increased risk of other diseases that can damage the kidneys over time. A prime player in this is diabetes mellitus. Diabetes is much more common in our overweight and obese cats. So much so that there are many cats I can put into remission with a strict diet plan. Diabetes affects how the body processes sugar, and as a result, it puts a lot of strain on the kidney. High blood sugar can damage the delicate filtering units that live inside the kidneys, leading to further decline in kidney function. High blood pressure, or hypertension, is another concern. Overweight cats are more likely to develop hypertension, which causes an increased pressure in the blood vessels, including the blood vessels in the kidneys. So now you've got an organ that's surrounded by a case that can expand, and the blood vessels inside that organ, inside that case, are getting bigger due to the increased pressure. It's not a good scenario. That pressure damages kidney tissue, and that damage accelerates kidney disease progression. Urinary tract issues are also more common in our overweight and obese cats. Problems like urinary tract infections or bladder inflammation can cause stress and inflammation that impact kidney health. Besides urinary tract inflammation, we also have to be concerned with general inflammation. As I had mentioned, fat tissue isn't just a storage deposit. It's metabolically active and it releases inflammatory chemicals. Those inflammatory chemicals in obese cats creates a state of chronic, low-grade, generalized inflammation. Chronic inflammation, whether it's outside the body or inside the body, creates damage at the cellular level. Those cells can be anywhere, but it definitely affects cells within the kidney and may worsen kidney disease over time. But let's also talk about hydration and mobility. Overweight cats are often less mobile, they're less active, they're less motivated. While you would think this reduced activity would lead to a decrease in food, that's not usually the case, but it definitely leads to a decrease in water consumption. Mild dehydration can become a chronic normal state for the cat, but even when mild, that ongoing dehydration can stress the kidneys, and that stress increases the risk of kidney damage. Last, there's the concept called glomerular hyperfiltration. This means that the kidneys are working harder than normal to filter the blood. Research in dogs and humans shows that obesity can cause this hyperfiltration, which can ultimately lead to chronic damage to the kidneys. And while there isn't much research on this in cats yet, we do believe a very similar phenomenon occurs in cats. And that means that the kidneys in obese cats are in a constant state of strain, inflammation, and damage, which simply isn't sustainable over time and sets them up for kidney disease. All of these things together help explain why obesity just isn't a cosmetic issue or more than extra cute, fluffy weight. It can quietly set the stage for kidney damage or make existing kidney disease worse. This makes managing your cat's weight an essential part of protecting their kidney health. Understanding how obesity affects kidney health can also help us see why excess weight can make managing chronic kidney disease more challenging once it's diagnosed. One key issue or player is that blood pressure. Controlling high blood pressure is critical in kidney disease because that high blood pressure speeds up damage to the kidneys. Unfortunately, obesity makes controlling that high blood pressure even more difficult. And that means that the kidneys are under even greater stress. This complicates treatment and means we need to either get more aggressive sometimes, we need to monitor more often, or grab for different treatment options. Next, diet plays a role in managing chronic kidney disease. Cats with chronic kidney disease often need special diets, not only to support their kidney health, but to reduce the general workload of the kidneys and support their overall health. However, obesity can make things much more complicated. Overweight cats may resist portion control, they may be finicky in what they choose to eat, believe it or not, and they may have different nutritional needs than those of a lean cat. Balancing weight loss with proper kidney nutrition requires careful planning and should be done in a partnership with your veterinarian. Another important aspect is muscle loss. In CKD, muscle loss is common, but in obese cats, it's actually harder to see that muscle loss because the excess fat hides the muscle. Monitoring a cat's muscle condition score, or MCS, is very important in a disease state because if it's getting worse, it means the disease is progressing and the overall health of the cat is declining. So in summary, obesity can make high blood pressure management more difficult, complicate diet changes, and mask muscle loss, all of which impact how your cat does with CKD. This is why preventing obesity before CKD is ideal, and why weight management remains critical even after diagnosis. Now that we've covered how obesity impacts kidney health and complicates CKD management, let's talk about what you can do as a cat caregiver to protect your cat's kidneys and help their overall well-being. Honestly, the best approach is prevention. Maintaining your cat in a healthy body condition score, or BCS, typically between 4 to 5 on a 9-point scale, is really key. This means your cat should have a visible waist when you look down on them from above. It also means you should be able to feel their ribs relatively easily. If you're unsure about your cat's body condition score, definitely ask your veterinarian about it. They can absolutely show you what you're looking for. And if your cat is overweight, the goal is to achieve weight loss slowly and safely. Rapid weight loss in cats, as much as we want to do it sometimes, can be very dangerous. It can trigger something called hepatic lipidosis or fatty liver, which can be fatal in cats. You want to aim for gradual weight loss over time with the guidance of your veterinarian. And keep in mind that regular health screenings, particularly in cats 7 years of age and older, are essential. Annual blood work and urinalysis can help catch kidney disease early. For senior cats or those higher at risk, sometimes twice yearly checkups can provide even better monitoring. Hydration is another important factor. Encourage your cat to drink by providing multiple sources of water, whether it's in a bowl, a mug, a fountain. Feeding canned food mixed with some water will sometimes achieve this end. There are water supplements that can be used, and even sometimes putting ice cubes in a bowl will attract their attention. Proper hydration supports overall health. Notice I said proper hydration. We don't want overhydration either. Excessive water isn't any better than not enough water, so it's really important to find that balance. Remember, when you're managing your cat's weight and kidney disease, you should be in a partnership with your veterinarian. Don't hesitate to ask them the questions you need answers to. To wrap up, obesity is a serious and often overlooked health condition that can significantly impact your cat's kidney health, both by increasing disease risks and making current diseases harder to manage. While it hasn't been proven that obesity directly causes kidney disease at this point, it definitely creates conditions that can accelerate kidney damage and worsen outcomes. That's why keeping your cat at a healthy weight, encouraging proper hydration, and maintaining regular veterinary checkups is so important, especially for those senior cats that have already been diagnosed with CKD. If you found this information helpful, consider sharing my channel with another cat caretaker who could benefit from the insights on caring for senior cats and managing chronic illnesses like kidney disease. If you have questions or experiences you'd like to share, leave a comment below. I'd love to hear from you. Thanks for watching, and remember, proactive care can make a big difference in your cat's quality of life.